Hello everyone, welcome back to our channel. Today we are going to learn about an important concept in the community medicine, that is how to write a clinico-social diagnosis. So what exactly is a clinico-social diagnosis? It is a comprehensive diagnosis that includes two components. One is the medical component, one is the social component. Medical component includes the medical and the clinical aspect of the disease, while the social component includes the social determinants that influence the onset of the disease, that may influence the progress of the disease, that may have some implication on the treatment as well, or it may affect your outcome of the disease. Now we'll see how to write the clinico-social diagnosis. As we have already stated, it has two components. In medical component, we have to write the medical diagnosis. That is the diagnosis of the medical condition of the index case which you have been allotted. So, what other things have to be added in the medical diagnosis part? We have to write about the principal medical condition. The, the cases which are usually being allotted in your examination include diabetes, hypertension, ARI, protein energy malnutrition, or diarrhea, or some other cases may be allotted. Along with the medical condition, we have to mention about the duration of illness, from how many years or the months the medical condition is present in the index case. What are the associated comorbid condition in the case? For example, if the case is of diabetes, the patient is also having hypertension, or the patient may also be suffering from cardiovascular disease, or the patient may be suffering from hypothyroidism. So all these associated comorbid condition to be mentioned in this. We have to also specify the severity of the condition, the stage or the phase of illness, that the disease is in the early stage or the disease is in the advanced stage. What is the progression of the disease? And we have to also include the complication means the secondary problem which are arising from the primary disease, like neuropathy in diabetes mellitus. And if we have some laboratory and investigative finding with us, the important findings which are relevant to the case need to be mentioned. We are also being allotting you the ENC cases in your examination. So what is to be mentioned in ENC case? We have to write about the priority of the patient, the period of gestation, whether the patient is registered or not, how many ENC visits patient has taken, whether the female has received both the TD doses or not, what is the status of consumption of IFA and calcium tablets, and ultrasound finding. So all these things to be mentioned in case of ANC. Now coming to the second part of the clinico-social diagnosis, that is the social component. This is the enumeration of adverse social factors in the family. These may have a directly or indirectly influence the precipitation of the disease or its appropriate management and the rehabilitation. So here we have to enumerate the inadequacies which are found in the family health study. That may include the low socioeconomic status or the illiteracy, or no regular follow-up, or if there any social problem in the family, unimmunized children, overcrowding, poor ventilation, school dropout. So in social diagnosis, we can include the following factors which are relevant to our case. Housing condition, that the housing is pakka or kacha, overcrowding, ventilation, sanitation. So overcrowding and ventilation, they are particularly important in respiratory conditions. The status of water supply, sanitation, open defecation, these practices are important in diarrhea cases. What is the socioeconomic status of the patient? May have implications on the treatment. treatment compliance or the follow up of the patient, whether the patient is able to purchase the long term medications or not, what is the education status. You can also mention about the occupational factors like exposure to the dust or sedentary job that may be relevant in case of NCDs. Also include the dietary habit, like, and these are particularly important in case of diseases like diabetes mellitus, hypertension, the cases of protein energy malnutrition. In ANC also, junk food consumption can be linked to the diabetes and hypertension. And to mention that the diet is adequate or inadequate in terms of calorie intake and in terms of protein intake. What is health seeking behavior, whether the patient is reporting regularly or not, whether we also have to include the family type, support system, the type of family, the nuclear or joint, and the family members are supporting or not. The cultural or religious belief play a very important role in the community setting, because that may affect the uptake of the treatment, and that may also affect the regular follow up, and particularly important in long term treatment of the patient, or in ANC cases as well. If there is any kind of addiction or social problems present in the family, that also need to be mentioned. So we'll understand how to write this with the help of two examples. I have a case one, and I'll be giving the details of case one under different categories as the data you take during your examination. So here we have a case of Mr. Ramesh Kumar, who is a 58-year-old male who lives in a semi-urban area with his wife and two adult children. He works as a shopkeeper and has a sedentary lifestyle. The family belongs to the middle socioeconomic status. They live in a pakka house with access to basic amenities but limited awareness of preventive health care. There are total 4 members in the family, and no family member has a habit of regular physical activity. Mr. Ramesh was diagnosed with the hypertension 2 years ago. So, this is your medical diagnosis of your case. During a routine health camp, he was prescribed antihypertensive medication but has been on irregular treatment. And these are other symptoms. His BMI is 29. He smokes occasionally and consumes a high diet, high food frequently. So, in during your examination, you will be taking the actual data where you can also mention about the calorie and protein. And but here it is mentioned like high salt, high fat food diet. So, we will mention only this in the clinico-social diagnosis. His father also has a hypertension. So, this is family history, who died at the age of 60 due to a stroke. And the environmental social factors of this case is that there is a high availability of processed food in the neighborhood, and cultural belief. High blood pressure is due to tension and not prevention. So whenever you are taking case in your examination, you can jot down the important points at the end, important medical points, and what are the important social point in your case. So here we have, in medical condition, the patient is having hypertension, he is overweight, irregular treatment, and the modifiable risk factor in this case are high salt, high fat diet, sedentary lifestyle, smoking, and the irregular BP monitoring. And the non-modifiable include the positive family history. Uh, and the socio-cultural barrier include the low health seeking behavior and environmental factors which have implications on the treatment or the compliance of treatment, availability of processed food, non-utilization of nearby park for the physical activity. So one step is to merge them in the form of paragraph using small phrases. Like, as we have framed the clinico-social diagnosis of this case as a 58-year-old shopkeeper from middle-class family, known hypertensive for 2 years, overweight, irregular medication with monitoring. And you can see we have also included the social component. So what we have done here, we have merged the whatever important points we have noted from our history. Coming to case number 2, in this we have a female who is 24-year-old Primi Gavita who lives in a joint family in the rural area, and her husband is a daily wage worker, and she lives in a joint family, and they belong to a lower socioeconomic status and lives in a kacha house. There, the nearest sub center is 3 kilometers away and the PSC is 7 kilometers away. She is currently 6 months pregnant. She is a registered case at the PSC. She has received only one dose of TT and only one antenatal checkup so far. And she has not undergone any blood or the urine investigation. That is important finding. IFA tablets have been given, but she often misses them. This is also important, that compliance is poor, and her diet is mostly cereal based with low intake of fruits and vegetables. Her family and cultural background include that visits are needed only during deliveries, and the decision making is mostly with the other members of the family, and no one is aware about the importance of ANC visits. So here how we have framed a 24-year-old Primi Gravita who is 6 months pregnant with incomplete ANC, complains of weakness and leg swelling. She has a poor compliance with IFA tablet due to nausea, and her diet is cereal based with deficiency in fruits and vegetables. And her healthcare is affected by multiple factors like low family awareness, decision making by elderly, cultural belief of the family, transport difficulties, and the low socioeconomic status that may have implications in the further follow-up visits.